This is Lisa Jones giving a report of a fictitious patient going from pediatrics to ICU. I will be using SBAR, situation, background, assessment, recommendation. I will also be doing ISB, ARR, identification of self and patient, situation, background, assessment, recommendation, and readback. Hi, this is Lisa Jones from Pediatrics. I have a patient I need to call report on, please. Thank you. I'll hold. Hi, Mary. This is Lisa from Pediatrics. I need to give a report on Lucas Christmas going to 3. He's an 18-year-old male that needs to be transferred to you guys due to worsening of pneumonia, possibly due to e-cigarette use. Increased need of monitoring, and he's in sickle cell crisis. Lucas came to pediatrics from the emergency department last night at around 8 p.m. with left lower lobe pneumonia. He has a history of asthma, sickle cell anemia, high function, and autism, and has been admitted several times for pneumonia. His last admission for pneumonia was about 8 months ago, and he was intubated at that time. He had an admission 3 weeks ago at MUSC in Charleston for sickle cell crisis. Today, around noon, Lucas started having increased shortness of breath, chest tightness, and his oxygen saturation dropped to 81%. He was already on 10 liters of oxygen nasal cannula. He was placed on a non-rebreather at 15 liters per minute, which increased his saturation to 89%. Then he was placed on an albuterol nebulizer continuous. His saturation increased to 91%. Dr. Smith felt that with Lucas's history that he may need to come on over to the ICU in case he needs to be intubated. Poor mom, patient started vaping 6 months ago when he left college. Patient minimizes use to only 2 to 3 times a month. At present, he is on a continuous nebulizer with his oxygen saturations running from 90 to 91%. Blood pressure is 90/47. Heart rate is 126. Respiration is 26. Oral temp of 100.9. His dose and weight is 56.8 kilograms. He's allergic to tree nuts, but no known drug allergies. Patient has diminished breath sounds to the left lower lobe with scattered crackles and wheezes throughout. He has been coughing up dark green sputum, sometimes blood tinged, for the last 3 to 4 days. Blood cultures were obtained prior to antibiotics in the ED. A sputum culture was obtained this morning. His lab showed white blood count of 26, red blood count 2.65, hemoglobin 8.1, hematocrit 26, leukocytes 18.1, platelets 683, glucose 156, retic count 16, lactic acid 2.8. Patient will need a repeat lactic acid tonight with his 9 p.m. labs. He has a 20 IV to the left forearm, infusing normal saline at 125 an hour. Another 20 to the left hand, infusing Rocephin 1 gram at 250 an hour. He did have his first dose of Rocephin 2 gram in the ED last night prior to admission. Patient has received all his scheduled AM medications, including his home meds that are being continued. Patient last had Dilaudid 2 milligrams IV push at 4 o'clock for pain. The pain was 8 out of 10, mostly to the upper back and left lower leg. He got Motrin 800 PO at 4 o'clock this afternoon and Tylenol 1 gram PO at 1:20. Both were for fever. His last temp was 100.9. His highest temp while he was on pediatrics was 102.7, and that was at 1 o'clock this afternoon. But he did have a Tmax of 103.7 in the ER. Patient's home medications are folic acid, Toradol, multivitamin, PMVK, albuterol nebulizer, albuterol inhaler, hydroxyurea, MS Contin, and prednisone dose pack. The admission chart from UMUSC Charleston is on the hard chart at the desk for your reference and has been scanned into his medical record. Patient does have a hard copy of all his past admissions at the bedside. He has a very strong family support at the bedside that has been with him in the ER and on pediatrics. It has been explained to the family that he couldn't have anyone spend the night with him, but they could wait in the waiting room, and that there are certain visiting hours for ICU. He is very anxious, wanting to return to school. He's a freshman at the Citadel in Charleston. Do you have any questions? Yes, he has been seen several times in the past year for pneumonia and has been intubated once in that time period. No, his last admission was not for pneumonia. It was for sickle cell crisis at MUSC in Charleston about 3 weeks ago. Yes, he does admit to vaping, last time being yesterday prior to coming into the hospital. No, he does not smoke regular cigarettes, just vapes. Patient denies need for the nicotine patch, though. Do you have any additional questions? Okay, I'll be available to midnight tonight. If you have any questions, just give me a call at extension 6306. Thank you for taking a report of my patient. You have a good night. Bye.